Does your pet have bad breath, really bad breath? You've tried a good teeth cleaning, but the smell just won't go away. The problem could be a warning sign of something serious. On this episode of the Paw Report, we meet veterinary oncologist Dr. Joanna Schmit, who'll discuss oral tumors, but that's not all. Stay with us.
The Castle in Mattoon, Illinois, a gaming bar serving the Mattoon area since 1929. Full bar, draft beer, allocated bourbons, rotating daily specials, APA pool leagues, darts, and more. Monthly craft cocktail nights, open mic nights, and karaoke weekly. The Castle's lineup of concerts and events are on their Facebook.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
Welcome to this episode of the Paw Report. I'm your host, Kelly Goodwin, and as you can see, we are on the road again for this episode of the Paw Report. We've traveled north to the University of Illinois to the Veterinary Teaching Hospital, and today we're joined by first-time guest, Dr. Joanna Schmit. Thank you so much for joining the Paw Report program, taking away from your daily schedule and inviting us here into the Veterinary Teaching Hospital. As a new guest, we always put you on the spot.
Sure.
And tell us a little bit about Dr. Schmit and her journey to the University of Illinois.
I can. I'm originally from Minnesota, was always a bit of a science outdoorsy kind of kid. I never had the traditional story of I want to be a vet when I grow up. I sort of stumbled upon it because my first career was as a veterinary technician, and my first job was in oncology. And I absolutely loved it and decided I should probably go to vet school. So I went to vet school, still thinking I would potentially just be a general practitioner, but ultimately made my way through all of the additional training necessary to become board certified in medical oncology. And I was lucky that I did that training here. So I came here as a rotating intern and then stayed for my residency and master's. When I left the university, I went out into private practice for about 10 years and then came back 2 years ago to join the clinical trials team because we're growing quite quickly.
Mm-hmm. We'll hopefully talk about a little bit more growing that's happening here at the hospital a little bit later in this episode. But essentially, to dummy it down for people like me, you're a cancer doctor.
Correct.
A cancer doctor for dogs and cats. And today we're talking specifically about oral tumors that can develop both in the mouths of dogs and cats. What is an oral tumor?
An oral tumor is anything that grows, like you said, within the mouth. So that can include the gums, that can include the base of the teeth, the jaw, the tongue, the palate, which is the roof of your mouth. So anywhere in that space is what we constitute as an oral tumor.
What causes oral tumor?
There's not a very certain cause, so there are some associations. So in cats, we can see an increased rate of them getting tumors if they come from a smoking household or if they've eaten canned food, and we believe that's from the carcinogens that are in them licking the smoke off their coats or from the canning process. There are otherwise just more commonly just age-related changes. So the older a pet gets, the more incidence of cancers, of all cancers that can occur, and that's when we'll tend to see oral tumors.
Do you see a lot of them? Is it a popular type of cancer that you see? I mean, I know there's all types of different cancers. But
so for us, yes, because we see only cancer. But if you're looking at the general population, the incidence is 0.5%. So roughly 5 dogs or cats in 1,000 will get an oral tumor.
What are the clinical signs? I think probably people would say, well, there's a tumor on there, I mean, but there may be some other things like bad breath or other signs that something not right's going on.
Correct. Oral tumors are actually very tricky to diagnose because pets hide their symptoms for a long time, and that's one of the challenges for us with treating them is we don't know they're there till they're bigger. So you're correct, bad breath is a common one. You may see blood in the water bowl when they drink. Sometimes they will avoid hard foods or playing with their toys. In cats specifically, we often see that they stop grooming or that their front paws are dirty, and that's because of the blood and whatever they're grooming from their mouth, it's getting onto their limbs. So there are very common things that we see as veterinarians that a lot of owners wouldn't know to watch for, so that's why we're trying to get the word out to help find them faster.
And owners probably, especially for cats, if they notice something like this, it's hard for the average person to start digging in their mouth and they won't accept that.
Absolutely.
Animals are like, no, you're not gonna, so that's probably the telltale sign to get with your local vet to start the process of getting that checked out.
Absolutely.
Are certain breeds more prone to getting oral tumors?
Yeah, cats, it's pretty general across the board of all cats. In dogs, chow chows, because they've got the black tongue, that pigment can cause them to have melanomas, which is common in dogs. Also poodles and schnauzers and cocker spaniels are a little bit predisposed for melanoma specifically. Some of the retriever breeds can get fibrosarcomas, but technically any dog can get an oral tumor.
I'm a pet owner. I notice some of the clinical signs that you've talked about. I call you, I come in. Can you take me through the stages of diagnosis?
Absolutely.
How you figure out what's going on?
In a cooperative pet, we do a thorough oral exam if they don't want us to look in there, as some don't, cats specifically.
Yes.
Sometimes it's a sedated oral exam so that we can take a look. A lot of times we're trying to figure out if it's tooth-related, like dental disease versus an actual mass. So sometimes your family vet will recommend a dental cleaning as well. But once we find a mass, we can either aspirate it, which means we just stick a needle into the mass, pull some cells out, and send that to the pathologist to look at, or we can actually do a tissue biopsy. So it depends on the size and location what may be recommended.
How does the cancer typically progress? If somebody's not, a pet owner's not noticing something, or maybe they notice something, they don't think anything serious is going on in there. How does it usually, what are the stages of the progression?
Yeah, so the rate of change of what the tumor is going to do is completely dependent on the tumor type. So some are very slow growing, they will sit there for months and not cause a problem, and some will show up and within 2 weeks you have a very large ulcerated, potentially smelly, bleeding mass. So it just depends on the cancer itself.
Tumor types you mentioned in that answer. Can you take us through those differences of the different masses that you see?
Yeah, so in dogs the most common would be melanoma is one that we see a lot. So sort of the opposite of people. They get skin melanoma, and we worry about that. Dogs tend to get melanoma in their mouth or by their toenails, and melanomas in the mouth are very aggressive, so that's a common one in dogs. We also see squamous cell carcinomas, so that's just, the title tells you where the tissue of origin is. And so squamous cell carcinomas happen in cats and dogs, and then in dogs we also see fibrosarcomas, but for cats, definitely squamous cell carcinoma is the most common. It's one that we study a lot here because it's very challenging to treat and often diagnosed late because cats are very stoic and the tumor likes to grow either in the back of the mouth or under the tongue, so they're hard to find.
And I'm sure with different cancers, the time frame of growth can vary?
Absolutely. Yep.
I mean, can it be as quickly as weeks, or does this go months, or does it go years? I mean, what does that look like?
Yeah, weeks to months depending on the tumor. So some will truly pop up and within a couple weeks go from, the size of a Tic Tac to the size of a kiwi, and they can be very, very large. And some will just start out as a little bump that doesn't really grow very fast, and then we really have to say, is this really a concern? That's usually where we biopsy to try to get more information of, is this truly problematic? Or there are benign changes that can happen in the mouth too. You can get proliferation of the gums and just other things that aren't cancer. So that's where we sample. Sampling is very important in getting to the bottom of what it is.
Just like a human diagnosis, I would suspect that pet owners getting a diagnosis that it's cancer can be shocking, can be upsetting, scary, on a lot of different fronts. What does the treatment process for a diagnosis, can you take us through that process? Is it as simple as, surgery, we're just going to take the tumor out and then Fido will be good to go.
Usually we start out with what we call staging, which is evaluating their overall health to see if their body's healthy as well as if the tumor has spread, because if the tumor has spread, that's going to change what our treatment options are. So like you said, surgery is one of the top things that we will use to treat oral tumors. The nice thing is if they can be cut out and removed and you can get all of the tumor, in many cases we have long-term control or cure. The challenge is faces aren't very big in dogs and cats, especially cats. And so if the tumor is already, say this big and that's how big the cat's face is, it's very challenging for us to actually do surgical removal. Other things like tongues can't be removed. We do remove portions of jaw and teeth and lips and things as needed, and many times have a really nice cosmetic outcome. But essentially the big categories for treatment are going to be surgery, which is generally first, radiation, chemotherapy, or immunotherapy. And the difference between chemotherapy and immunotherapy, chemotherapy is what we traditionally think of as people getting its injections of drugs that kill cancer cells or pills. Immunotherapy is stimulating the body's own immune system to actually seek out the cancer. So they're a little bit different, but both are medications that are given to the pets.
Much like humans. You just took us through the options of pets, and it's very much like the humans.
It is.
Outcomes for pets with these sorts of tumors has dramatically improved over time with the improvement of veterinary oncology, which is your specialty. Agree?
Yes,
That's
yes, and some tumors we absolutely have been able to get far better outcomes. Like I said, some are curable, some remain very stubborn. So melanoma and oral squamous cell carcinoma in cats, so melanoma in dogs, squamous in cats, those are the two that remain the most stubborn and ones that we investigate a lot here with our clinical trials team, because we have made less impact in getting those cured or improving their survival. So that's really a focus for us here to really see how we can improve survival time.
You hit on, investigations and looking into. We're going to pivot our discussion just for a little bit and talk about the importance of clinical trials when it comes to, lots of different medical situations in veterinary medicine. But let's talk about specifically clinical trials as they are married to oral tumors and how that plays into your daily work life. Can you talk about promising new treatments for dogs and cats with oral tumors thanks to clinical trials? Yeah.
So at a basic level, clinical trials let us investigate new things. So those are new drugs, new therapies, new combinations of both of those to see if they are safe and effective. And so in diseases where we haven't made much headway in the last 10 or 20 years, we look to say what's better. And so for us, with oral melanoma in dogs, we have been doing immunotherapy trials for the last few years, working with some doctors out of the East Coast in Boston, and that research has actually made its way into humans now. So we were the baseline for dogs. That's called comparative oncology. So we use dogs to compare to humans, and it's a way to escalate drugs getting to people faster. So that's been very successful. We are also looking at squamous cell carcinoma in cats because that one is very, very stubborn. We've been studying that for years here because we really do believe we will find a way to break through on that one. And we've used combinations of new drugs with radiation therapy. And in some of our patients have had really good successes of keeping the tumor controlled for a year or longer, which is uncommon with that disease if it's not surgical.
How long do those clinical trials usually go on? I mean, we're going to talk about some trials here, but are they months, are they years before you can get all the information that you need and then start putting it to good use?
Yeah, so there are various types of trials. So some are just looking at safety. So it might be 3 weeks to 2 or 3 months. And then the ones where we're looking more at effect, those generally are a year, year and a half. So it'll depend on the trial type. For our oral tumor trials, those are generally a year or longer.
Might seem pretty obvious, but what are the benefits to being part of a clinical trial? You've been a part of them. You obviously need clients down the road to participate in these, but let's start with the pros, the benefits to studying them.
Yep. So to the pet itself is access to care that may not exist anywhere else. So in that investigational or novel type therapy we have here where no one else could. For the family itself, trials are often funded or partially funded. So if finances are a concern, that's somewhere where they can actually get care for their pet, where the financial commitment is less. From a more altruistic side of things, it helps us help pets in the future. So we may only get a small bit of information from your specific pet, but the big picture help is that down the line we're going to be able to treat cancers better. So there's a few different reasons, and then of course from our standpoint, we want to take that to advancing our successes and helping humans as well.
And there are different types of clinical trials, as you mentioned. There could be trials involving drugs, there could be trials involving immunotherapy, radiation.
Correct.
Are those really the only, at least in your area, are those the three that are the big ones that you look at?
Correct.
So when you have a clinical trial, when you're getting ready to launch a clinical trial, is that when you start promoting, hey, we need, if your dog suffers from this or your cat suffers from this, how do you actually generate your pool of subjects for those trials?
Great question. We work with veterinarians, local and far. We have patients who come from Boston and Kentucky and California, you name it. Clients are very good at getting on the internet and finding us, but we try to get the word out locally, doing things like this, newspapers, so that people know we're here, because a lot of times they just didn't know. And once they find us, they can come. We have a great website that keeps our clinical trials up to date. So if you go to the University of Illinois and look for clinical trials, you'll find all of the trials for all of the specialties. And you can access us, and then we have a coordinator who you can call and ask questions to, as well as talk to your family vet. So I think the biggest thing as a pet owner is to advocate and say, is there a trial somewhere? It may not be here, but there may be others close by, because there are trials at almost all universities, and it's a really nice way to find something that may make a difference in that individual pet more than what we would use as traditional therapy.
And the university would work with those local vets in different communities potentially, to gather, engage information.
Absolutely.
And that sort
we
of
work
thing.
with all vets, no matter where you come from.
Any potential medical risks that maybe that clients may say, I really want to do this, but I'm just not sure?
Yeah, so the risks are going to vary based on the trial, and some risks are very known, and we're very upfront with what we know to expect. It can be mild things like a fever, diarrhea, maybe an upset tummy. We are also transparent to say we don't know. We've never used this drug before. This is why we're starting to see what it does. That's very common for us with combinations of therapies. We'll use drug A and drug B separately, but we don't know if we combine them if there's a side effect. And so we always start with a lower dose and work our way up so that we can try to avoid those side effects. But we're very clear to the client of what we expect to see, and then that there's always an unknown that we may not have any idea what we could see. That's part of what the trial is going to show us.
So that's in the arena of drugs. What about the immunotherapies? What about radiation? Same concerns? Or?
Similar. Immunotherapy is a little bit different because it's immune system. So when you trigger the immune system, it can kind of do whatever it wants. It can cause things like fevers. It can cause some struggles with liver function. In people, it can attack certain organs, like it can attack your thyroid, or it can attack your heart or the lungs. So we don't tend to see that as much in animals, but those are the things we watch for and pay attention to. So immunotherapy has a less known scope of side effects as it's newer to us. So far, we have had pretty good success as far as managing those side effects, in that we can tell the client what to expect and we can help the animal through it, and it's not a significant effect on their quality of life.
Currently, you and your staff in the University of Illinois, they're involved in a clinical trial involving cats and oral tumors, which is what we talked about earlier. Can you talk about how that is going? We're recording obviously here in the summertime. This segment will air a little bit later, but is it ongoing? Have you discovered any revelations into your clinical trials that are just surprising to you and your staff?
Sure. So we have been studying oral tumors in cats here for quite some time, squamous cell carcinoma specifically. So a lot of our trials are a mutation of the first thing we learned, and then we move it into something else, and we're kind of in that phase right now. So we're combining radiation therapy with another drug that's called olaparib, which is an oral chemo. And the combination of those, basically radiation causes damage, olaparib it inhibits your body from fixing the damage. So we're trying to damage the cancer cancer cells so that they die. Then we have added on a new drug that's a normal FDA-approved drug in cats, but has what we call an off-target effect, meaning it's being used for cats with diabetes, but it also has some effect on cancer cells themselves. And so that's what we are doing, and we've had very good success as far as side effects and how they're tolerating it. And a couple of the first cats have tolerated quite well.
How many cats are involved in that trial? I mean, do you have to have a certain number of animals involved to really get a good pulse on, what you're hoping to find or not find?
Yeah, typically we want a minimum of 9-ish. Sometimes we go up to 30. It just depends. We've enrolled less than 10 in that one right now, and they're doing fine. We also will pivot the studies, meaning if we find something's working great, we'll chase that down rather than wait for our other results, or vice versa. If it doesn't seem to be working at all, we may say, hey, we need to shift how we're doing things. So it's a very dynamic process. It's always changing based on what information we're getting as we treat each patient.
I know you're also always working on other clinical trials. You don't just have one and then that's the end-all be-all. Do you have partnerships with other universities maybe that you could share with us on any other trials that are maybe on the horizon or in the works or happening right now that you can share?
Yeah, we work with Northwestern fairly commonly. They help us do some genetic modification of lymphocytes and T cells for dogs. So we do that one. Like I said, we work with some researchers, human researchers out on the East Coast, out of Boston. We work with other vet schools as well, Colorado State, Ohio State, University of Wisconsin. So those are called multi-center studies, so where we all participate. Most of our studies are our own, but probably a quarter of ours are also multi-center.
What can you say to a pet owner that it's still sinking in? My pet has cancer.
Yeah.
Pets can be our children, they're part of the family, and I'm sure part of your job too is being comfort, being support for those families that come in and learn. What's the best advice that you could give to them? Somebody that just has recently got a diagnosis about their animal.
Yeah, I think what people tend to feel most is powerless. And with working with your veterinarian and a veterinary oncologist, you gain information, and information is power. So it may be that there's very limited options for your pet, and we keep them comfortable. It may be that if you're willing to treat aggressively, meaning a combination of surgery and chemotherapy and radiation, we can provide a long-term outcome. I think people worry about the financial aspect of it and whether or not it's within their means, but also what is that pet going to have to go through to get there. And so we're here to give that information. It's a lot of what fits for the family, what fits for the pet's actual, demeanor. Like, do they love coming to the vet? Do they hate coming to the vet?
Right.
And really what's going to be the best move so that everyone feels comfortable with how the disease progresses. It isn't something that inherently can be changed, right? Cancer is cancer. We all have had personal connections with cancer. But it's getting everybody in that family, including the pet, through that process so that they feel like they were successful in honoring that pet's life and keeping them comfortable and doing what they felt they needed to do medically.
Right.
Yeah.
We have just a minute left in our discussion today. Let's talk about the future here at U of I and the future of veterinary oncology. Very exciting time for the school and for the hospital. As we pulled in today, we saw loads of construction going on, and we discovered that a new addition here to the veterinary hospital is in the area of cancer treatment. Tell us about that project.
So we are quite lucky. We are adding a new wing to the vet school itself. So oncology will have a new wing on the south side. We will have our own separate entrance, our own workspace, exam rooms, which is really nice to keep those cancer patients separate from other sick patients. We have been very generously given some money from supporters of the university to make that happen for us. So we have outgrown our space. So we are very happy to have more space, but it also gives us the ability to grow more. Trials has been expanding quite a bit. We are expanding our team entirely as far as we sort of function as 3 services: radiation, med-onc, and clinical trials. And so as we grow, it's going to be wonderful
Need more space.
Yeah, and wonderful for our referrings and our pets. It's really going to be comfortable and nice and allow us to continue our work.
Dr. Schmit, it was a pleasure meeting you. It was a pleasure having this discussion with you, and definitely some information I'm certain our viewers enjoyed hearing and learning about, especially if they're going through something like this. So thank you for your time. A first guest here on the Paw Report, and you hit it out of the park. Thank you so much for your time.
Thank you.
And thank you, our viewers of the Paw Report, for joining us for this episode of the Paw Report on the road at the University of Illinois. Until next time, we'll see you then. If you're a veterinarian, trainer, groomer, specialist, rescue organization, or shelter that would like to partner with the Paw Report by providing expert guests for the show, please contact us by emailing weiu@weiu.net or call 217-581-5956. If you have a topic you'd like to see on the show or questions for our experts, contact us with those too.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
The Castle in Mattoon, Illinois, a gaming bar serving the Mattoon area since 1929. Full bar, draft beer, allocated bourbons, rotating daily specials, APA pool leagues, darts, and more. Monthly craft cocktail nights, open mic nights, and karaoke weekly. The Castle's lineup of concerts and events are on their Facebook.